Hello, awesome students. Let's learn about a nursing theorist named Gene Watson. To start, we're going to do Gene Watson's biography. Enjoy your nap. Gene Watson was born Margaret Jean Harmon on June 10, 1940 in the Appalachian Mountains in West Virginia. She was the youngest of 8 children. She married Douglas Watson in 1961 and moved to Boulder, Colorado shortly after, where they settled down and had 2 children. They had 2 daughters, born in 1963 and 1967. Gene Watson was an intelligent, dedicated woman who was passionate about her studies in the nursing community. She attended the University of Colorado and achieved a bachelor's, master's, and PhD, bachelor's degree of science in nursing, master's degree in specializing in psychiatric and mental health, and PhD in educational psychology and counseling. Passion led to great accomplishments that has significantly impacted the current field of nursing. Some of these accomplishments include graduating from the University of Colorado, member of the American Academy of Nursing, president of National League of Nursing, Dean of Nursing at the University Health Science Center, and 6 honorary doctorates. She clearly loves nursing. In addition to all these wonderful accomplishments, she also established the Watson Caring Science Institution, which is a non-profit organization which has helped spread her theories worldwide. We get it, Gene. You've done a lot. But wait, there's more! The 1970s was an influential time for the United States when Gene Watson first began her teaching career. Women, African Americans, Native Americans, gays, and lesbians were pursuing a fight towards equality that had become evident not only in politics but also in the healthcare system. It was at this time that Watson recognized the need to broaden the context of nursing once again, or as she described it, bringing new meaning and dignity to the world of nursing and patient care. Fighting against a primary biomedical model of medicine, Gene Watson worked to bring emphasis to patient-centered, spiritual-based care in the system where diagnosis and treatment were the focus. During the process, Watson referred her work with numerous cultures and societies around the world to bring a global context and diverse culture view to the profession of the theory of caring. The theory of caring consists of caring for self and others, transpersonal caring relationships, caring occasions, multiple ways of knowing, reflective, mediative approach. Caring is inclusive, circular, and expansive, and caring changes self, others, and the culture of groups. Sadly, in 1997, Watson lost her left eye while golfing with her grandson. Things only got worse as the next year passed. In 1998, she lost her husband of 37 years. The effect of these tragedies influenced the creation of her 3rd book, Postmodern Nursing and Beyond. Another revamp of her theory of caring was soon to follow in 2005 as she recognized the continuing evolution of her own concept of nursing. The 7 main concepts, originally including the theory, have evolved into 10 processes as Watson has incorporated her own life experiences following the abrupt changes she experienced in the late 1990s. Watson decided to transition to the 10 primary Karita processes by expanding on the original 7 factors. The processes allow for an intersecting between the personal and professional characteristics of nursing care. By analyzing, we gain a better understanding as how Watson interprets the person, health, environment, and nursing. Her ultimate focus was to put love and heart-centered caring into nursing practice. The first 3 curative factors make up the philosophical foundation for Watson's science of caring, namely, sustaining humanistic altruistic values, being authentically present, and being sensitive to self and others. The remaining 7 are built on a foundation based on the first 3, developing, sustaining love, allowing for expression of positive and negative feelings, creatively problem-solving, engaging in transpersonal techniques, creating a healing environment, assisting with basic needs, and opening a spiritual mystery and unknowns, allowing for miracles. Let's take a minute and try to apply these 10 Karitas to a clinical situation. Imagine you are working with a patient who is returning to the hospital for a repeat procedure. You know this patient quite well as you are typically the nurse assigned to their case. You know their name, and they know yours. It is typical to converse with your patient, about how their life has been since you last saw them, and your patient feels comfortable enough to express some concerns about how their medical diagnosis is affecting their daily life. You ask some follow-up questions to better understand your patient's worries. Concerned, you take some time to think of some ways that can help your patient with some of the obstacles they are facing. This may be finding creative ways for your patient to approach the demands of their diagnosis, or ideas on how they can alter their lifestyle outside of the hospital to increase their quality of life. As your conversation with the patient progresses, you administer the appropriate medications and procedures for which they were admitted and ensure that they were comfortable with the appropriate level of privacy that they may need. This patient is more than just another procedure for you. As a nurse, you want to ensure that they focus on the priorities of your patient, which requires you to understand more about their experiences and how it affects them. Congratulations! In this one experience as a nurse, you would have successfully applied all 10 of Watson's clinical corridas. Over the years that Jean Watson was involved in the healthcare field, she discovered that there were areas in this profession that were constantly evolving, as well as areas in this field that needed improvements. Watson focused her theories around putting the client into the context of family, the community, and culture. Her purpose of this procedure was to ensure that the patient was the focus rather than the technology. As nurses begin to incorporate Jean Watson's theories into their daily practice, not only was the patient care more personal, but also more meaningful. Maybe in this one moment with this one person is the very reason we're here on Earth at this time. By Jean Watson.